Hello, this is Stefan at Iron Direct Primary Care. Today I'm teaching you how to reconstitute the Wolverine protocol. This is BPC-157 plus TB500. We use it all the time for healing musculoskeletal injuries. It also can work for gastrointestinal, nerve regeneration, TBI, but usually we use it for MSK injury. So this is bacteriostatic water. I cleaned it off with an alcohol swab. We have a syringe with a needle, usually a thick needle. And what I'm going to do is I'm going to draw back, oops, almost bent my needle off, don't do that. Draw back to 1 ml. Ooh, that is a bent needle. Doesn't matter, we're not injecting ourselves with that. It just needs to make sure it goes through the rubber stopper. So that I popped off that rubber cap. It's going to go right through here, and you see this powder is going to turn into liquid. I'm going to throw this out. This needle is junk at this point. Now you don't shake peptides, you gently roll them because they are delicate amino acid structures. Peptides are amino acids. You can eat peptides, right? If you eat collagen, tripe in particular, so intestinal lining is where BPC-157 is inspired from. Obviously we don't eat tripe to get a healing effect. We inject a synthetic peptide from sources that we won't name. Now, I'm going to take this very fine 31 gauge 31 gauge insulin syringe. It has 30 units of measurement. We are only going to use 10 units. And that's because I reconstituted it with 1 ml. There are 10 milligrams of both TB5 and BPC, so 20 milligrams total of this product. Because math isn't our strong suit here, we want to make sure we can't mess that up. So 100 units, 1 ml, okay, that's what I reconstituted that down to. So I can draw 10 units and get 1 milligram, right? For the easy math. So this is already clean, this is a sterile top, but if not, if this is in your fridge where you should keep it, you're going to take that alcohol swab and clean off the top. Now try not to bend your needle. Go directly perpendicular down into the rubber stopper. Flip it upside down, it won't leak out, and draw back. I want to draw back 10 units so I can get 1 milligram. My dosing protocol is 1 milligram every other day to heal a musculoskeletal injury. Let's see, it's coming down very slowly. This particular brand is a little slow. That's okay. We don't need to rush things here. All right. Close enough. We're at 10 units. Now I don't want to shoot my very expensive peptide all over the place. I gently use 2 fingers to push up. Very push up until I see it start to bead at the top. I'm not going to, yep. I wasted a drop. Okay. Now for me, my injury is a little tennis elbow flare that flared up this week from all the training. Plus, I did have a beer. Shouldn't have done it. I'm training way too hard to be drinking beers. 1 beer, and I can feel the tendinitis. So I cleaned off that area that I'd like to shoot my peptide into, and I'm going to inject it right into the area of pain. Now it will work systemically, but there is a local benefit, specifically to TB500. There's very interesting studies being done out in Maryland by Regeneron, and they're using a topical eye drop of TB500, thymosin beta-4, for dry eye disease and other eye conditions because it has a local effect of regeneration. Same for BPC-157. So that's how you do it. You throw that out, right? This is a 1 use. This goes in a trash. Usually you can put it in a plastic empty water container, fill it up with your insulin syringes. It goes in the regular trash afterwards. Or if you have a hazard box, you can put it in there like I have. So this goes in the fridge, and again, it's 1 milligram every other day. That's how I dose the Wolverine protocol. And I've had great experience in research setting here at the practice. We do a lot of research and patients who are interested in using off-label repurposed drugs and peptides. So it's for research use only, and if patients want to use that, great. It doesn't have any side effects as far as we've ever seen, and it works. I mean, the cases we have, the case reports are tremendous, and hopefully we'll be publishing those at some point.